Differentiating cognitive decline in MS patients versus Alzheimer's processes in MS patients. Of course, none of this is medical advice. Always check with your doctors and treatment team before making any conclusions. However, the situation can arise where we have cognitive decline in multiple sclerosis patients. Unfortunately, cognitive decline tends to be a symptom that's not often focused on in the MS patient population because doctors tend to be more focused on the more pronounced neurological symptoms such as weakness, numbness, and/or vertigo, to name a few. So if the individual with MS or if the treatment team is working with an MS patient who is having symptoms of cognitive decline, what do we do? In 2025, one option that I've discussed is to look at the plasma biomarkers clinically available for routine use. These can include markers like amyloid beta in the form of the A-beta 42/40 ratio or p-tau 217. Though it's not completely confirmed, early studies seem to think that A-beta 42/40 ratio should be relatively preserved in MS patients, i.e. they shouldn't be affected. So if an MS patient presents with a normal A-beta 42/40 ratio, that's what we'd expect. However, if that is abnormal, that may lead to the question if there is another Alzheimer's process going on. Further, Alzheimer's disease tends to present with problems with language. So if the individual is having issues with naming objects, that can be important. Orientation can be important too, but naming lots of times is one of the first symptoms of naming objects and people can be one of the first symptoms of an Alzheimer's process. Whereas if it's involving more of learning, if it's executive function, if it's a processing speed issue, that may relate to more of an MS process. I'm Dr. Randall Gates, board certified chiropractic neurologist, chiropractic physician from Gates Brain Health and Advanced Imaging Reno. Check out my content, like, subscribe, and share. Have a great night.